So good afternoon po. My name is Denzel Alfred Illustre, and today I would be representing congenital heart defect pathophysiology. Tungkol siya sa decreased blood flow na pumupunta sa lungs of the patient, of the pediatric, once also known as Tetralogy of Fallot. Now, sa Tetralogy of Fallot, meron siyang different risk factors kung bakit siya na-acquire. So, congenital, meaning na-acquire siya habang nag-grow yung baby sa loob ng mother. And genetics na din. Including na din dun yung genetics, genetic makeup nung bata. So, una, including dito is yung chromosomal deletion of 22q11. Next would be maternal gestational diabetes mellitus. Next would be alcoholism. And lastly, nakita ko siya sa internet, retinoic acid exposure. Now, leading doon sa pathophysiology ng sakit, since na ano na natin yung mga yung mga risk factors niya. So forgive me kung naputol yung video kasi kailangan ko magtanggal ng storage sa sa cellphone ko. So parang part 2 na din to sa pathophysiology. So I was saying earlier, na-draw out na natin yung risk factors. Ngayon, i-draw out na natin yung mga targeted na points ng Tetralogy of Fallot, which is the overriding aorta, the pulmonary stenosis, the right ventricle hypertrophy, and then the ventricular septal defect. So, unahin natin si pulmonary stenosis. When we talk about pulmonary stenosis, it is a condition kung saan nagkakaroon ng narrowing ng pulmonary valve dun sa heart. So, hindi ko siya madadrawing kasi yung ganun mag-drawing. Pero, imagine na maliit yung pathway papunta sa lungs. Yung blood papunta sa lungs. So, nagkakaroon ng narrowing. Narrowing of the PV. Next would be right ventricle obstruction outflow. So, nagkakaroon ng pressure sa right ventricle. Mamaya pag-usapan natin yan sa right ventricle hypertrophy. Therefore, nagkakaroon siya ng reduced blood papunta sa lungs natin, ay sa lungs rather ng pediatric. Therefore, following that, nagkakaroon siya ng decrease ng O2 saturation since limited or minimal lang yung pupuntang oxygenated blood doon sa ating pulmonary valve. Which leads to hypoxia. Since na-draw out na natin sa pulmonary stenosis, next naman is sana magkasya yung marker. Next naman natin, sa tulad ng sinabi ko kanina, yung right ventricle hypertrophy. Ngayon, sorry dun sa ingay. RVH. Now, so I was saying earlier, sa right ventricle hypertrophy, since nagkakaroon ng narrowing doon sa pulmonary stenosis, tapos, syempre, nagkakaroon ng RV outflow obstruction. Dito naman, same concept. Nagkakaroon ng narrowing ng PV, tapos syempre nagkakaroon ng right ventricle obstruction outflow. Then followed by syempre, once na nangyari yung right ventricle obstruction, nagkakaroon ng increase ng resistance. Hence, na nagkakaroon ng increase na resistance sa isang area, nagkakaroon ng overwork of the heart. Overworking of the heart muscles rather. Okay. Once na nagkaroon ng overworking of the heart muscles, nagkakaroon siya ng hypertrophy. Also known as, nabasa ko sa sa libro natin, nagka-perform siya ng boot shape na heart. Wait na po. Sorry. So, following of the right ventricle hypertrophy would be... Naka-record na? Yes, naka-record. The ventricular septal defect. Now, sa ventricular septal defect, nagkakaroon na dito ng mixture of the oxygenated blood and the deoxygenated blood. Mamaya malalaman natin kung paano. Now, dito, nagkakaroon ng less resistance sa ventricular septum of the heart. Hence, nagkakaroon ng shunting. Also known as the mixture of oxygenated blood and deoxygenated blood. After yun nga nagkakaroon ng shunting. So therefore, yung deoxygenated blood na pupunta sa aorta, which is yung pathway ng aorta is to the systemic circulation. Papuntang systemic circulation. So idadagdag ko lang siya. Ang temporary management para dito sa phenomenon na to, usually pinapagawa is knee to chest tuck position. Why? Kasi para magkaroon ng pressure doon sa loob ng veins natin, para kumbaga parang mapilitan yung oxygenated blood na pumunta sa systemic circulation instead na merong deoxygenated blood. So, wait lang, naling line. So, management, knee, chest. Talking. Alright. And lastly, the last affected place ng heart sa Tetralogy of Fallot would be the overriding aorta. Now, dito sa overriding aorta, nagkakaroon ng increased blood flow, increased mixed blood flow. Yun na nga, yun na yung mixture ng deoxygenated blood and oxygenated blood. Blood flow, increased blood flow of oxygenated blood. And nagkakaroon siya ng aortic regurgitation. So, yeah, ito yung basic, hopefully, ito yung basic pathway nung Tetralogy of Fallot. Don't worry, ilalapit ko po yung camera dyan since gamit ko po is, highlighter. Tapos, may kulang pa pala. Now, for the signs and symptoms of the Tetralogy of Fallot, check lang natin. Okay. For the signs and symptoms, now, as knowing doon sa pathway ng mga sakit, ng mga nangyayari sa system, yung pulmonary stenosis, RVH, VSD, and overriding aorta, masabi natin na nagkakaroon siya ng cyanosis. You can say that our patient will be cyanotic. Our patient will experience shortness of breath kasi kinocompensate niya yung blood, yung oxygenated blood. So therefore tataas yung respiratory rate as well as yung HR. Next would be poor weight gain. Next would be clubbing. Yun. Isa yun sa signs and symptoms, yung clubbing of toes, and nails. Okay, toes and fingers. And as well as fainting. So that's it po. So ma'am, ito po yung yung pathophysiology ng Tetralogy of Fallot. Hopefully kita siya. Ito. And the signs and symptoms po, ma'am.